welcome, everybody. I'm going to invite the panel to introduce themselves. Claire.
Hi, good morning, everybody. My name is Claire Fox. I am in London right now. And yeah, I'm a coach, I'm a body worker, an intimacy facilitator. And really, my work looks at helping people to live more full and rich and just more juicy lives, and then offering that into the spaces of their work, their career, their relationships, but really kind of looking at that inner connection and developing that. So yeah, I do tantric body work. I work with conscious kink, with deep listening, and really supporting people into that journey into themselves and into more aliveness. I offer one-to-one sessions and private immersions, and I'm also working with Drew this year on some events that are going to be coming up in London, so that's exciting as well.
Hi everyone, it's a real privilege to be back again, actually, for the Sunday sex sessions. It's either here or fuck church, so it's great of a Sunday morning. My name's Drew. I have been an ecologist and a body worker for 30 years now. And in the last 12 or so, I've been working more specifically around the areas of sex, intimacy, sexual trauma, healing, energetics of sexual union, and so on, as well as being sexually active for almost all of my life. And in various different constellations. So I bring a lot of my personal experience here, but I also bring 3 decades of working with bodies and our relationship to self, each other, and the planet.
Hello, my name is Jeremy. Currently living in Berlin, where I do in-person sessions with people and also work online with people all around the world. I often tell people that, my work is based around love and lust, and so I got that tattooed on my hands. So I'm a sexological body worker, so I do hands-on work with people's bodies, but I'm also a sex therapist, sex educator, and a relationship coach and sex coach, and a group facilitator also. So, later today in Berlin, I'm doing a self-pleasure workshop class. I'm really passionate about people finding pleasure with their bodies and with other people's bodies, and also about healing. I think that there can be lots of little wounds we have in our bodies. So I do, emotional, like psychotherapy kind of trauma release stuff, but also like body work to help people take out the bruises and the kinks and the squished up bits, and to make us whole again.
Lovely. Thank you, Jeremy. Thank you for being here. Thank you all for being here this morning. We also have the gorgeous Fennel Waters, as mentioned already, in tech and emo support. Thank you, Fennel, for being here this morning. Yeah, wonderful. And I'm trained as a sexological body worker and wheel of consent facilitator and sex coach. Most of my work is with cisgendered heterosexual men, so straight men essentially. And I work with the view of exploring how pleasure can be more fulfilling for men. So sometimes that's around addressing sexual dysfunction, which is a horrible term, but helping people to find more joy in their sexuality. And sometimes that expands into working with partners as well. So sometimes I work with couples. Primarily, I'm moving more and more. My work is becoming more and more online, but I do offer in-person sessions as well. And I'm really delighted to hold these Sunday morning sex calls. I'm really enjoying them, and I'm really loving hearing all these different perspectives and experiences of people on the panel like we have today. So welcome and thank you. Thank you for joining us. So before we launch into the questions, I think I'd really like to clear up this thing that I get asked a lot. And as a woman, as I say, that works with a lot of straight men, And that's around whether enjoying any kind of anal pleasure or wanting to explore anal pleasure makes a man gay. And my answer is universally always the same. It's no. And here's the tricky part for me, because in my experience, anal pleasure is available to anybody with an anus, regardless of their gender or their sexuality. And if that involves another person in any capacity, and obviously they're of the age of consent, then that person can also be of any gender or sexuality. And I think what makes men ask me this question is this traditional reductive idea that heterosexual sex is only about, it's only proper sex if there's a penis and a vagina. And therefore, by association, the only proper form of gay sex or sex between men, particularly, is around a penis being in an anus. And that's such a reductive idea of sex and sexuality anyway, and then to kind of layer that into gay sex as if that's the only thing that matters is kind of, it's, I don't think that's really very helpful. And my work certainly is about exploring well beyond penetration what is available to us beyond that. And there is something also here about when people ask that question, there is this societal and cultural internalized homophobia that we're not even aware of. And it's because we swim in this soup of heterosexuality. And so anything that is different to that is often internalized as wrong or shameful. Even if we're not consciously aware of it, we all carry this idea that heterosexual is normal, when actually it's just common. What I do find is that these kind of questions do happen less when people begin to discover sensuality and expand the idea of what sex can be, and to understand that there is a whole spectrum of pleasure that our bodies are capable of, over and above bodies being penetrated. And yes, that can include exploration of the anal area, possibly inside, but definitely outside. And so I just was curious whether any members of the panel would like to add to that. Drew, is there anything you would like to add?
I think it's a great question, and I also loved your answer and your response to that. And I agree with this cultural soup that we swim in. And for me, there are a couple of things to add to that. I mean, there's, I think, a lot to be said around the shaming that can occur for very young babies, particularly around nappy training and potty training and poo and shame and smell, and the way whoever's our parents or whoever's changing our nappies communicate to us around that whole thing. Nappies are such a modern invention, and we're, as babies, we sit in our excrement, and then parents, whether they're being playful or otherwise, like all of this, oh, it's smelly, oh, it's wrong, and so on. It's also the only time really we get to touch ourselves as babies is when the nappies come off. So there's a whole load of stuff around that we can perhaps dig into, which creates a lot of shame around the anus and it being dirty and it not being pleasurable. So that's one thing that comes up for me. And another is, I've always been fascinated with and loved anal play. And there's definitely been some cultural conditioning around homosexuality woven into that for me. But I think there's something maybe more subtle or something else here that runs parallel, which is around the like the conditioning that it's not manly to be receptive, or there's some sort of anti-masculine, or that a man should be penetrative and strong and forceful and directive in the world. And the experience of receiving anal play as a man is a very receptive, subtle, sensitive, can be subtle practice. And it really impacts the energetics of the body, which hopefully we'll talk about later, which I think goes against a lot of the conditioning there.
Fascinating notion that, some sexual act will be an indicator of your sexual orientation or attraction. There's a lot of gay men who don't have anal sex. So the act doesn't make you gay or not gay, and you can't become gay. I think it's probably a lot more complicated than that. We have pleasure receptors all over our bodies, and we can have access to them without the conditioning. Like, I'm definitely for freedom and pleasure activism. So yeah, just enjoy things that feel good in your body.
How do I talk to my partner about wanting to try new anal play? Claire, would you be willing to start? Thank you.
Yeah, I can speak to this. So yeah, like when someone's wanting to explore anal play for the first time or in a new way with a partner, I think it's really important to just create a space for an honest conversation, and have it be where there is that space for an honest conversation. It's not like on the bus or in a kind of uncomfortable environment or where you don't have much time, but really sort of creating that space and safety with each other. And as well, looking at the reasons and being able to like accurately and honestly communicate like why it is that you're wanting to explore it. Like, is it about the sensations that you think may be possible for you? Is it about a particular fantasy or something more erotic or mental? Is it because it's taboo? Is it because it's just unexplored, or you want a different kind of connection? And just really kind of creating that shared understanding between you. Creating space to speak about the fears that come up with that, or the uncertainty, because I think for a lot of people there is a lot of fear associated with this part of the body. So just really sort of opening the communication channels for that to be a part of it and that to be okay. And then I think really creating a plan for how you're going to explore that if you do decide to explore together. Coming up with a bit of a plan of like, okay, what tools do we need? And I'm sure we're going to get onto that a little bit later. Like, what do we need around us to play with this? And what is our approach going to be? How slow do you want to go? How what do you need afterwards? Like, aftercare is really important, especially with something that's new or taboo. That definitely, it could bring something up, it could bring emotions up, it could bring some uncomfortable experience. Hopefully not, but it can happen. So also talking about what the aftercare looks like for you. Do you need to check in later that day? Do you need what else do you need in terms of kind of completing that experience and learning from it as well? And then I think the final thing I would say to that is around bringing play in. I notice a lot in the kind of mainstream sex sphere that it's all very serious. It's all very, oh, we're going to try anal sex for the first time, and it has to be like intense and very serious. And at least something I recommend to my clients is really around like exploring and playing together. This is like, sex is where adults get to be silly and playful and curious about each other and each other's bodies. So really bringing that sense of play and wonder and curiosity in, because you're a team, and you get to explore that together, and as well, not making meaning out of if it doesn't go the way that you planned, not making that mean something about you or your partner or your relationship, that it's just you get to explore and see what happens.
Douching and cleaning and the poop fears, I think, is really big for someone in the first conversation to be clearing. What are we going to do about that? Because we're trying to get things out of the way so that we can flow into pleasure. So I think that would be a thing that I would include in a first kind of conversation. But I totally agree with what Claire said, and especially that first bit, just timing. Like, are you open to this conversation now is a really important thing to ask.
How do I talk to my partner? Like, it really depends on who it is that we're engaging with, like what that relationship looks like in terms of, is it a long-term intimate relationship, or is it a partner that I'm meeting in a club or, you know, a first night or something, or in a workshop. There's also this piece. The other piece is around playfulness and silence, and with all the shame conditioning that's around anal play and poop play, I think you said, Jeremy, which I loved, or poop, like poop thoughts. Like shame can take our voice. So to keep coming back to playfulness and to keep coming back to just the vulnerability of and the courage required to ask the questions and to hold each other with enough care to kind of get it wrong and explore it and not know in the inquiry.
It is about permission to get it wrong, and also this idea that we can have practice sessions. You know, this is intimacy between people, whether that's 2 people, 3 people, 4 people. You know, when we take away the sounds and we take away the lighting and we take away the Viagra and all of those other things that we see in porn, we take all of that professionalism away from porn, and we're actually just 2 or 3 or 4 people in a room together. You know, it's funny. It's funny. It's just like when you take the sound away from a music video and you're watching the performers. It's funny. And the invitation is to bring that sense of playfulness, as has already been shared, but also maybe just have practice sessions. Just agree that it just doesn't have to be perfect. Okay, so tonight, we're going to amass all of our toys, and we're going to get everything together, and we're just going to practice and see what happens without this constant need to perform and to get it right the whole time. Give yourselves permission to get it wrong. Give yourselves permission to care for each other. Give yourselves permission to say, I'm sorry, or I asked for that, I thought I wanted it, but actually I don't. So when we bring this kind of mindset into any kind of intimacy, but particularly anal pleasure, you know, you can't really go wrong, because you're agreeing that you're going to make mistakes and you're just practicing and exploring. What is prostate pleasure?
That's a great question. I have a little demonstration model, because finding the prostate is an important thing. It's a gland that's located inside the anus of people that are born with a penis or assigned male at birth. And to find it, let's just start with some anatomy. So if a person's lying on their back and you put your finger inside the anus and point up towards the cock, then you'll find the prostate gland. And some people describe it as like it's like a walnut that's like covered in skin, almost a little bit flatter than that. And they can have different sort of shape and texture. Like sometimes some are just curved and some have kind of like 2 little curves in them, a little bit bigger, a little bit smaller, depending on the person's age and just how they're born. And the prostate gland, you can locate your own. So I can actually put my hand inside my own body and find my own prostate gland. But it's probably easier if someone else does that. The pleasure there's a pleasure potential is actually probably a better way to describe it, because some people have no sensation in their prostate, and that's just like another bit of tissue in their body. Some people have a lot of pleasure, and some people can have orgasmic, transcendental, squirty stuff happening everywhere, pleasure experiences. Sometimes this part of the body has been compared anatomically to the G-spot. And there's some good reasons, like the shape. They both secrete prostatic fluid. There's potential, but sometimes it needs to be woken up. So sometimes I've worked with someone's body where there was not much sensation, and we did a lot of touch and massage, and then that could wake up this part of the body in a way. If you're getting someone else to pleasure you, then that can be done with a finger. And just to get the length, like we're talking about, like the tip of my finger, if it goes inside inside an anus, I'm pushing up, and where the tip of my finger is would be about where the prostate gland is. So it's about that far in, but it can be a bit further and different. But it can be pleasured with a finger. It can be pleasured with like a dildo sort of toy, vibrating sort of toy, or a cock. And you can also stimulate the prostate from the outside. I hope my anus model is helpful. So from the inside and from the outside at the same time. So you're sort of like squeezing, because the prostate's in between there. And really some kind of basic ways to touch if you're going to put your finger inside a person's anus, prostate. There's what I call windscreen wipers. So you can go sort of backwards and forwards. You can do what's called, some people call milking, which is like quite a firm stimulating, and that can make different kinds of ejaculate come out of a penis. And you can do sort of like pushing, and it's also possible to do circles. So for some people, it makes them feel like they need to pee because the urethra is going through the prostate gland. And so we're familiar to the sensation of needing to pee, but this touch can bring that also. And like I said, the prostate is the place where liquids, what's the best word, from testicles go up and through and out the penis. So it's also a place where if you stimulate it, there can be ejaculate also, but different from a normal sort of cock pleasure ejaculation. It can be slightly different. So it can be without an orgasm and just ejaculate, or orgasm and no ejaculate, and a range of different things.
I have a few toys as well, so this is probably a good time to show them. One of them is this theta wand, which allows me to access myself internally and externally with these different points here. So I use this for cock massage, and this thing called de-armoring, which we may talk about later, but essentially to work trigger points around my cock, but also around my pelvic floor musculature and internally. This is like a little, kind of like a butt plug, but it's designed to be worn specifically for prostate kind of massage and health. A bit tricky to sit on, but it can be in there, but it's nice to wear. And then the third one I brought along for show and tell today is this one here, which can be what this kind of ring gets worn over the cock and balls, or a erect cock, and then that one pops up in the bum for some prostate touch. In my experience, a prostate pleasure is a very surrendered experience. Like, it's a kind of a letting go pleasure. There's a loss when I have prostate orgasms and anal and prostate orgasms. There's a kind of a loss of self, not in that kind of like quite short period of a few seconds around ejaculating, but a real, like, it's like a submission, surrender experience, which can be, I think, as Jeremy said, like very like, I don't know, big words like tidal or intergalactic or transcendental for me, like which feels more like a kind of a subspacey type experience, which I think also is a bit challenging for a lot of men, because, you know, we're more used to being the penetrators than being penetrated. But for me, prostate, and my experience, my journey with prostate pleasure, and this is very much the experience of a lot of my male clients, is one from numbness / freeze / terror through to kind of this kind of sense of a slight discomfort, but yeah, you're kind of finding it now, and bit of some pee, weird something, and then gradually over a series of sessions, for me, when I received 6 or so of these sessions many years ago, some trauma release, some emotional release, through to then softening, relaxing, opening, and really starting to feel like the pleasure systems of my body come online. So yeah, it's been a journey that I've had, and one that I love working with male clients on.
Yeah, I just saw this related question come from Fennel. If someone is not ready for internal exploration regarding the prostate, I've read that it can be to some degree, access from the outside, how might that look? Yeah, often when I'm giving intimate massage, you can press the perineum and access it that way. So beneath the balls, before the anus, and what I've experienced giving massage there is that you can really get in quite deep. You can put your thumbs in and really kind of press into the body in that area, which is still touching the prostate and kind of working it a little bit. So that's something that people, can do. Maybe ask a partner to help you with, if you're not ready for that internal stimulation, but still kind of want that activation and release. It can be very grounding and very releasing for someone to be touched there. Yeah.
Great. Thank you, Claire. Thank you. Yeah, in my experience of offering massage, I too experienced the spectrum of men who want to experience prostate pleasure. And for some men, there is very little sensation there to begin with, and therefore they kind of give up. And then for some men, over a period of sessions, this will waken up, and they'll have deeper access into these altered states, these blissful states. And I also want to speak to the fact that for some men, there will never be any anal pleasure. So this is not something else to achieve, or something else, this sacred holy grail that you've got to chase of prostate pleasure. For some men, there is very little sensation there. There's not much particular pleasure there. So sometimes, and it's great to explore that a little bit further, but it's not like something else you have to achieve. So, and it very much depends on where people are at, how the distribution of nerve endings in their pelvis, all of these kinds of things that we have very little control over. I've tried to give anal, but my partner freaks out a lot. What's going on? Sometimes I barely touch her.
Thing like what, as I think Jeremy touched on, like this relationship between prostates and prostate tissue and the paraurethral glands, or the skein glands, or the G-spot area in the female anatomy. Like, my understanding of it, and it's not like, I know there are different thoughts around this, but I do understand that there's a fairly scientifically proven evidence that these tissues come from the same original tissues. So let's pop that to one side for the moment, and perhaps talk about the anal sphincters. And I have a quote from a dear friend of mine and colleague, Dr. Kate Lister. So Dr. Kate tells us that human beings belong to a group of animals called deuterostomes, which develop anus first. In humans, after the sperm breaks through the egg's outer membrane, the embryo splits into many different cells, eventually becoming a blastula. The blastula cell rips open from the inside out, forming an opening called the blastopore, which becomes the anus. In the beginning, we are just embryotic arseholes floating around in your mum's womb. And just after that happens, the blastopore continues to kind of travel through the blastula, and then essentially what happens is a tunnel gets formed, and that tunnel splits, and one end of the tunnel becomes the mouth, the lips, and the other end becomes the anus. And then a whole load of other, then the embryo develops, and the vagus nerve, which we'll talk about a little bit, is developed around all of that. The organs are external before it kind of folds in on itself and internalizes the organs. And so there appears to be, well, there doesn't appear to be, there's some very strong connections between the sphincters, the main sphincters along this tunnel from lips to bumhole. And it's also, it's innervated all through the organs by the vagus nerve. So, and the vagus nerve is the nerve that kind of reflects or manipulates the activation of the sympathetic and parasympathetic nervous system. So in the anus, we have two anal sphincters. There's the external anal sphincter, which is as another colleague of mine shared recently, are kind of very connected to the skin of the body. It's kind of the skin system meets the external anal sphincter, and we have control over that, whether we clench or release. It's kind of like the bum clench muscle if we need to go to have a poo and aren't near a toilet. But the internal anal sphincter, which sits just a little bit inside the external, is actually made of smooth muscle, ring muscle, and that's is probably the only place we can access the smooth muscle through touch in the body. And it's directly connected, it's autonomic, it's directly connected to the autonomic nervous system. And that's where a lot of the power and potency and vulnerability of anal play comes in, because this muscle is like I've heard someone describe it as the master key to the nervous system. And so it's very, very sensitive, and it's very, very robust at the same time. There's such vulnerability and there's such deep access into the nervous system of the body through this internal anal sphincter that any non-consensual, surprise, uncertain, excessive force touch around these sphincters at any point in our lives can cause a big clench in the body, a big freeze, like a kind of a trauma imprint in the body. And I mean, for me, I had suspected appendicitis as a child. I had a number of doctors' fingers up my bum when I was in hospital that time, without any being told what was about to happen, other than get on your hands and knees. I'm going to inspect and check you for appendicitis. And we can, when we're in play. I also had a partner who, she stuck her finger up my bum during oral sex without giving me any warning when I was quite young. And all these many, like in heterosexual sex, a cock can slip out of a pussy and go into an anus, like with no one knowing what's going on. All these things, a lot of guys who think, oh, I'll just whack it in there and see what happens. So the anal sphincter can hold a lot of trauma, and that can trigger all of these what we call kind of freeze or dissociate responses in the sympathetic nervous system, parasympathetic nervous system, fight or flight, freeze, and so on. So often, if we're just, even if if a woman or anyone feels their anus is just slightly exposed and perhaps available to being touched or penetrated, it can trigger all sorts of like bodily responses: freeze, dissociate, detach, and so on, or fight. So if that happens in play, that's why communication is so important. One of the main reasons. That's why consent. And it's also why going really, really slow and taking a lot of time around this, because just the conversation can trigger trauma and panic.
I think some cultural ideas that it can hurt anal sex, and I would say it should never hurt. If you're hurting, it needs more warm up or lube. Like, I hope we're going to talk some more about different kinds of lube, but getting the right lube for this experience is incredibly important. So don't do things that hurt. Lots of warm up and good lube is my suggestion. I love to talk about lube. There's different forms. It kind of goes down into water-based, silicone, and then there's hybrids. And then oils, like vegetable oils, and then the whole other class, there's this thing called J-lube. I would say water-based is not good for anal pleasure because the mucus inside the rectum is designed to suck up moisture, liquid. So you have to keep putting it in. Silicone lube can be really great. And there are things called a shooter, which basically is like a syringe with no needle on it, that you can fill with lube, put it in the anus, and put the lube inside, because putting some around the outside is good, but it can also be good to have some inside. There's a product called Crisco, which is a solid, and it's a vegetable fat used for cooking, mainly in America, and that's really good. And then J-lube, which is a veterinary product, which is I don't understand the chemistry, some whole other field of polymers, and just super goopy, slippery, slimy stuff. And I've found that personally, professionally, J-Lube is probably the best. But some people make mixtures and then put them in shooters and shoot them inside. So yeah, getting good lube is really important, and high quality also. Yeah.
Thank you. And just we'll talk about safer sex later, but just to say that anything that with oil, because I use oil a lot in my massages, but anything with oil will degenerate condoms. So it's probably better, as Jeremy suggests, to go with these kind of high spec lubrications rather than relying on something like coconut oil, because they will just erode the barrier, whatever barrier you're wearing. What are some of the things I can do to prevent pain?
So yeah, lubrication is super important, because the ass is not self-lubricating like a vagina is. So yeah, that's why we've talked about lubrication. Pain, yeah, I think for me, both in like personal and professional experience, really just like slowness and super slowness. Like you can't go slow enough with this. I definitely, like, personally speaking, I've experienced where if it does go too fast, that's when I can like sort of shut down, and actually it's then like complete no, like it kind of pushes me over an edge that then there's we have to sort of start, close it down and start again later. But so like when there's that just like real subtle sensitive slowness and exploring together, that can really, yes, support in opening up gently. And then asking your own body, like really having that communication within your own body and your own system, and asking your anus, like, am I ready? Am I feeling open to this? And genuinely waiting for your body to respond. Kind of having that communication with yourself, and also the awareness that some pain may come up and may emerge, and if that happens, just to to say stop, to sort of slowly remove whatever's inside, and yeah, try again another time, because that can it kind of is a hazard of exploring anal play, is it can be painful. So just kind of acknowledging that, and yeah, going slow.
I think there's probably two forms of pain, and that can be the friction on the skin, and that's where the lube is important. But it can be about the tension of the sphincters. I mean, it's really helpful that our sphincters hold poop in, so they're doing a great job. But they really do need a lot of massage and warming up. Breath can help. So if you're breathing out, you're relaxing muscles. And that's something, and also a person can clench their sphincters. And so if you're putting a finger inside someone's anus, you can say, oh, okay, I want you to squeeze. And then when they let go, it opens a little bit more. And this is just a muscle thing. It's like you put tension on a muscle and then you take off the tension and it just softens a little bit more. And also numbing creams. There is a whole lot of weird products in sex toy shops that like local anesthetics. Don't do that, because if you're covering up pain, you may actually injure something, and people get anal fissures, which is like tears around here if something's pushed in when it shouldn't be, not ready. So yeah, really against anesthetic, numbing anal creams. Like what Claire said, if it's not going to happen today, don't do it, or just be slower and more warm up.
Also, you mentioned fissures, but also things around hemorrhoids and, other things to be aware of, and lots of ways of treating those, or, from yogic inversions through to preparation H creams and so on. But it's to do with, as Jeremy was saying about relaxing and squeezing and relaxing. There's also a lot here around pelvic floor health and wellness, and the different, like, most of us have a kind of a sympathetic clench in the body, like we're in some kind of like chronic sympathetic response in lives with the way we live our lives, in at least in the Western cultures. And so, like, relaxing, there's a difference between clenched and saggy so that poop comes out, and actually having pelvic floor tone, which can come from lots of like breathing exercises and associated Mula Bandha practices and Kegels and so on. And that can give us greater capacity to tense when tension is appropriate and relax when relaxation is welcomed. And there's other whole piece in there around excessive tension. This was taught to me by a Neo-Tantra teacher. Excessive tension blocking the movement of energy up and through the spine in a kind of microcosmic orbit way, if we're looking at Taoist sexuality, or Kundalini rising way in yoga, which again, sort of having that tone in the sphincters can support the release and movement of energy.
Kegel exercises tend to focus on the tightening of the pelvic floor, and I use something called the deer exercise, which is similar to the Kegels, but the focus is on actually the release. Because very often people view exercising the muscles as, you know, I've got to tighten this so it holds everything in. Yes, that's important, and the relaxation will help deal with this chronic pain or this chronic tension that we carry, particularly in our pelvic floor that you mentioned, Drew. And also the other thing that I tend to do with tantric massage is when I'm offering anal touch or internal anal touch or prostate massage, is I actually do a lot of warming up of the area, long massage, lots of external anal touch. And then my invitation is always for the client to move onto my finger rather than me inserting my finger. The invitation is for the client to move onto me, so that because they know what the sensation is, they will know if they're ready to go slower or faster or deeper or harder, and I invite them to move, so my finger is present for them rather than my kind of insertion. And then that gives the client, especially, it gives them more autonomy, gives them more choice, and it's likely to address this issue around pain, because they know what they're experiencing. And very, very, very quickly, the other thing I say to people is, you know, the thing about anal pleasure is that if you're experiencing internal anal pleasure and then you're suddenly not, this is my experience with a lot of clients. All of a sudden they're like, oh yeah, this is really beautiful. And then all of a sudden it just, that sensation stops. That is the body saying, no, I'm done. That's enough. And so and it can be very tempting for people to stay there and to try and recreate that initial rush. No, the body is done. The body's had enough. Time to stop, and to recognize and honor that within yourself, and just notify whatever the person that you're with. That's it. I'm done. Yeah. And there to be no shame around that. That's perfectly normal. So normalizing that. I'd like to open it up to the chat to see what people have shared here. Somebody has mentioned that slowness and boundaries, boundary timeframes aren't represented in porn. So what I always say about porn is it's staged. It's totally staged. Even amateur porn is staged. And, you know, when we see anal sex, you know, we just see this pounding, 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 pounding. That is not normal. These people are professionals. You know, they've been training for this. And maybe they are wearing numbing creams or whatever, because these things are filmed over a number of days. So nobody should ever be expected to perform sexually like we see in porn. Drew, yeah.
Yeah, I mean, something, this might be adjacent, but like I've been looking at porn since the late 70s, and what I've noticed, like broad brushstrokes over those decades, is that like to a certain extent, at least the porn that I encountered, late 70s was magazine based or softly lit, you know, VHS or Betamax type recordings where there was some kind of build up foreplay-ish stuff, even if the music was a bit gentle. Then in the 80s we kind of went more into sort of the foreplay was, you know, the plumber showing up to fix the pipes, and then like it seemed to have gone through these phases. The 90s was where as far as I could see, this explosion into anal sex in hetero porn, but now we're at this place where, and this is I think is the same for all of Western society, like dopamine hits are so quick. Porn is all mostly video. It's just like 30-second, 40-second clips straight into it. So for massive and fast and rapid dopamine rushes and changes of source of sensation and stimulation. So there is just no space at all in kind of modern digital video porn for any sort of foreplay. I mean, there's loads of pornography that does have that, like so-called ethical porn or conscious porn or queer porn. There's a lot more around it in these spaces, but in the sort of hetero clips of the online porn tube things, it's you know, it's so removed from the reality of the nervous system, the mammalian nervous system that we've cultivated over millions of years, as to be just like extremely potentially extremely damaging and toxic for the system, without meaning to shame the use of and the enjoyment of porn. We have to it's important to know that it's very far removed from what our bodies need and are used to.
Any advice around someone who has irritable bowel conditions? Should anal pleasure just be avoided, or just when, or only avoided just when there's a flare or irritation? Did do a little bit of research around this, and it kind of sidles along. Is it a risk for women of developing anal incontinence from anal sex? Is this correct? Any research on this? There's a guy called Jack Marin, and he wrote a book called Anal Pleasure and Health. He says that there is no indication that even frequent anal intercourse leads to incontinence. And he checked this out with a number of physicians. However, there's been a number of small-scale studies, and in the University of Alabama, they stated that anal intercourse is linked to increased risk of incontinence, both in males and females. And I think the study did not provide data on the frequency of the practice of anal intercourse and the impact of incontinence, but it did show a relationship between the practices of anal intercourse and fecal incontinence, more so among men than women, interestingly. But they don't know whether that is due to the nature of anal sex between men and women, and there may be a difference in that. Fecal incontinence is often caused by muscle and nerve damage around the rectum, constipation, certain diseases, surgical procedures, and childbirth. Basically, and they reinforce this idea that Kegel exercises are really useful. So this strengthening and release of these pelvic muscles is good for everybody, regardless of whether you engage in anal penetration or not. If you are experiencing some of the physical conditions that make that whole area difficult, the digestive and the bowel functions, if you experience difficulties around that, constipation, muscle damage from childbirth, and hemorrhoids has been mentioned, abscesses, fistulas, overusing laxatives, Crohn's disease, IBS, pelvic organ prolapse, all of those things are going to make anal exploration so much more, the need to be so much more careful with this. And being kind to yourself and listening to your body is probably the bottom line. Folks on the panel, do you have anything else that you wanted to add to that?
I would say something about irritable bowel syndrome, IBS, which is something that I have, which is really about microbes. Some microbes want to be in some place on the digestive system and some want to be in other places, and we shouldn't mess them up. And this is why we don't eat poop. And that's not a safe practice. And also, like, people doing very intensive enemas can actually displace microbes from further down to further up, and you don't really want to be doing that. So, but to answer the question, anal pleasure and IBS are probably unrelated. I mean, but there's many forms of IBS. But just, following all the safety things we've talked about. But yeah, I hope we're going to talk a little bit about douching and cleaning out, because that's important, I think, if you do have digestive symptoms like this.
Yes, great. Thank you. Actually, let's come on to that right now. Let's talk about hygiene. So, Jeremy, would you like to continue your thoughts around hygiene?
Yeah. One safety thing is that a vagina is basically a pocket, is a one-way street. An anus is a long tube. And there's all those amazing x-rays online from emergency wards of people who've inserted things in their anus that don't have a flange. So if you're going to put something in your butt, you need to make sure that it's going to go in and then it can't go a lot further because things can get lost. So a little just tiny safety thing. Sex toys for anuses are made with like a little bait, a flat base, so they can only go so far. I think cleaning out, douching, kind of the same thing, is really great. I think it's a lot of fun. I don't know if any of you have I don't have one here, but basically, you can buy these little devices. It's like a little bulb, like about the size of an apple. You put some warm water in it. It's got a little tube. You put some lube on it. You put that inside. You just squirt, I don't know, maybe it's 100 mils of water inside the rectum, then sit on the toilet. That comes out. Repeat a second time, and you're going to clean out the whole of the rectum. I mean, and there's normally not a poop in the actual rectum. It's normally further up. But I think it's really reassuring for many people to know that there's less poop involved. But when I have anal pleasure with people or professionally, I will always say, hey, there might be some poop. We all have poop. Poop's fine. You may see poop. That's all okay. So yeah, cleaning is good, and not to put other liquids in there, like no soaps or oils or whatever. Like, this is just just put in some water, let it come out. But you do need to wait like 20 minutes or something, because sometimes you need to then go sit on the toilet again because there's some liquid that wants to come out. Yeah, that's my thoughts. Some people like enemas, some people like colonic irrigation. And if you're going to do longer, more intense sessions that might involve fisting, then there are people who will change their diet, get colonics. You can really go down the rabbit hole, up the rabbit hole on cleaning.
Things that have been in the anus should not go near the vagina afterwards. It's really important because it's actually quite easy to get an infection like a UTI or the kind of bacterial infections. So it's just like really important that condoms are removed or toys cleaned, fingers cleaned, that kind of thing. Rather than going back and forward or remembering which hand's doing what is a really good thing to remember in regards to hygiene.
Just to build on what Claire said about things that go in the arse shouldn't go in the pussy, like also to be really aware of saliva. Like we haven't talked about rimming yet, but for those of us who enjoy engaging in rimming and it can get quite wet and salivary, to be conscious of where saliva can run. I just saw a question pop up around exactly that. So I have a friend who loves to eat ass, and it can get there's a lot of pleasure in there. So once you've gone through the hygiene piece around cleanliness and washing, shower, bath, and so on, asses are more accessible usually when the body is face down, but then saliva can run down into the pussy. So, but you know, you can find different positions that work, but also you can take towels, flannels and so on, or just be really, really careful about that. Like there is also, you know, the saliva is antibacterial, and Claire's just mentioned antibac mouthwash. So there are a bunch of ways of avoiding and minimizing that. Or of course, and we may talk about this in terms of the STI chat, but we can also use cling film and sort of other barriers around touch and rimming and so on. So yeah, and you know, whether or not we engage in something like double dipping, like you say, like presence, slowness, awareness, and a lot of condoms or gloves are always great if we do like play in those ways.
How can I play it safe with anal pleasure and STIs?
You know, you can break that down into bacteria, bloodborne viruses, yeasts. For me, sexual health is really a lot about a conversation. Like, do you have symptoms? When did you get tested? How many partners you had? Like, these are important things as much as the barriers and the practices, but knowing what is the risk with that person you want to play with. And, you know, what's happened in the world is that there's this thing called PrEP, which I can't remember the acronym stands for, prophylactic something. It's basically a medication to stop transmission of HIV. But when we had high transmissions of HIV before PrEP, gonorrhea and syphilis were down because people used a lot more condoms. Now people don't use condoms, and gonorrhea and syphilis has gone up, while HIV has gone down, which is good because HIV is was lethal, not anymore because of antivirals, but it's a lifelong virus. So yeah, more people are getting syphilis and anal gonorrhea, which are both treatable by antibiotics. So I think, you know, on this topic or any just regular STI checks at a doctor or a clinic are so important. There's two kinds of condoms. People used to call male and female, but I would call them internal, external. So we're used to one that goes over a penis or a toy, but you can also have ones that go internally into a vagina or into an anus. And if you want to do that porn thing where you're like in a pussy and in an anus, if you put an internal condom into one of those holes, which I've done, means you can go between the holes. Does this make sense? Because you're only having fluid contact with either the anus or the vagina.
And we have a few minutes left. Pegging. Can we talk about pegging? I think, Jeremy, you'd...
yeah.
Would you be willing?
Yeah, I'll say a little bit about it. It's a term that was coined by Dan Savage, who's an amazing American sex educator, and got famous from a little bit of a porn film called Bend Over Boyfriend. I can't remember the name of the people who made it. American sex educator, a woman who was getting a harness, so like I don't know how you describe a harness, like a belt system that holds a dildo so she could fuck, like insert the dildo into her male partner's anus. And this is what's called pegging. Can have many different forms and many different harnesses. My recommendation is if you're going to do this, buy a really good quality harness. There's a couple of different types. There's like one that looks like underwear, and the dildo kind of goes in the front. I think they move around a bit more. I think pro doms that I know use ones with like straps that you tighten because you want the dildo to stay in the same place. And it can be a really wonderful experience for a woman to be penetrating a man with what looks like a cock, a dildo. So yeah, highly recommend that. But again, you know, buy quality things, buy a quality harness, and buy quality dildos also.
I can add a couple of pieces that just came up for me. One of them is around size. Like if you're a beginner, you can get these smaller girth dildos, and you know, I think also thinking about toys and things, you can get like sets of different sized toys to kind of work your way up to something bigger. So if you're like first time pegging, you might not want to get like a monster size dildo to try with, because it might just not work. And the other thing, which was another kind of not really hygiene thing, but silicone toys with silicone lube often disintegrate a little bit. So it's recommended not to use, like basically to use another material if you're using silicone lube.
I want to share that I've heard of with my clients, but also had direct personal experience of some very profound learnings or experiences that happen when both a man is pegged and a woman puts on a strap-on. Like, I was with a partner some years ago where they were like everything changed for them when they looked down and saw they had a cock and could take the energetics of being in the penetrative position. Like, it was absolutely profound. And also as someone who receives, I touched on this earlier on, but the vulnerability and sensitivity and tenderness that is so often required to receive in my anus, especially from someone that went from a lot of freeze and trauma and shame and the gay thoughts, the dirty thoughts, that it's not okay to have pleasure in my arse thoughts that I had when I was younger, to someone that now loves to receive and has a transpersonal experience sometimes when I am receiving. It's incredibly beautiful and powerful to receive from a romantic, intimate partner, and I only have really romantic, intimate interactions with with women. But also, like, there is also this piece around, and I know this isn't pegging, but while I don't have erotic, romantic experiences with other men, a real cock feels much better than a silicone cock in my experience. So so there's just also like an adventure and an exploration that I've been in, and it's been a way into really opening myself up in my bisexuality to kind of celebrate receiving a real flesh into my body. This surrender for me as a man, to be pegged or to be penetrated, is it can move into the realms of like a sacred or transpersonal experience. And when we look at sort of and this is coming back to the ecology piece of like, I think it, like, not only does it make me a much better penetrator when I learn how to be penetrated, but it's also a practice. It's like a sacred practice of surrendering to God, spirit, the world. And just to finish, because I know we're on time, like, it actually makes me a better ecologist. I'll leave it on at that.
I think that there's a banner there, isn't it? Anal sex makes me a better ecologist, or anal sex saves the world.
I'll just lube up a sphincter while we complete.
I'm afraid that's all we have time for. There were other delicious questions to explore, and I just want to really honour what we've shared here today. And I really want to thank the panelists here today. So thank you, Claire Fox. Thank you, Drew Lawson. Thank you, Jeremy Shub. And also thank you to Fennel Waters for holding space for us too. And thank you to everyone who signed up and registered, for people who are in the space today, and people, if you're watching this afterwards on the recording, thank you for being here also.